In today's video, we'll cover two important pediatric cases. First, we'll discuss a common contagious skin infection in young children, and then we'll explore a case about bone pain in a teenager and its surprising link to a childhood tumor. A father brings his 5-year-old son to a community clinic due to a skin rash that developed near the corners of his mouth over the past few days. The boy is active and playful, and his vital signs are normal. The father reports that the rash started as red spots that quickly turned into small blisters. These blisters ruptured and left behind areas covered in a yellowish crust. The child attends preschool, and his teacher mentioned that a few other students have had similar symptoms recently. The affected area is not painful but is mildly itchy. Which of the following is the most likely causative organism? A. Coxsackie virus. B. Herpes simplex virus. C. Parvovirus B19. D. Staphylococcus aureus. E. Trichophyton rubrum. The correct option here would be D, Staphylococcus aureus, and this is because this patient has impetigo, which is a common and highly contagious superficial skin infection, most frequently caused by Staphylococcus aureus and sometimes by Streptococcus pyogenes. It typically begins as a small pustule and then ruptures and forms classic honey-colored crusts. Although the lesions may appear concerning, they are usually not painful and often cause mild itching. Let's have a look at why the other options are incorrect. Option A is incorrect because Coxsackie virus is the most common cause of hand, foot, and mouth disease, which typically presents with fever and shallow oral ulcers in the mouth, followed by the eruption of an erythematous macular or papular rash affecting the palms and soles. Coxsackie virus also causes herpangina, which manifests as posterior palatal ulcers without a rash. And option B is incorrect because the patient in our question had a painless pustular rash, whereas herpes simplex virus usually develops as ground vesicles on an erythematous base that unroof into painful ulcers with scalloped borders. And primary herpes simplex virus infections may have fever and malaise, and the children can also develop gingival stomatitis with involvement of the gingival, oral, and pharyngeal mucosa. And option C is incorrect because parvovirus B19 infection, also called erythema infectiosum or the fifth disease, is classically described as a slapped cheek rash. And the infection begins with non-tender erythematous patches on the cheeks. The patches then fade as a lacy erythematous rash develops over extensor surfaces of extremities, and the rash do not typically crust or flake. And option E is incorrect because Trichophyton rubrum is the most frequent cause of tinea corporis, which is a superficial fungal infection. It presents with expanding erythematous scaly lesions with central area of clearing, and it is usually itchy. A 14-year-old boy presents to the clinic with ongoing left knee pain and a noticeable limp that has developed gradually over the past several months. He describes the pain as deep, persistent, and worse at night. He denies any recent trauma. His medical history is notable for treatment of a tumor during infancy. On examination, there is localized swelling and tenderness over the distal femur with increased warmth. Radiographic imaging shows a destructive bone lesion with a classic sunburst pattern at the distal femur. Which of the following conditions was this patient most likely treated for in infancy? A. Acute lymphocytic leukemia. B. Astrocytoma. C. Non-Hodgkin lymphoma. D. Retinoblastoma. E. Wilms tumor. The correct option here would be D, retinoblastoma, and that is because a sunburst pattern at the distal femur is characteristic of an osteosarcoma, which is the most common primary bone malignancy that typically affects individuals between ages of 10 to 25 years. And although most cases are idiopathic, but there is an established molecular mechanism between retinoblastoma and osteosarcoma. Let's have a look at why the other options are incorrect. Option A is incorrect because acute lymphocytic leukemia is associated with Down syndrome. The patient in this question has an osteosarcoma, and there is no clear relationship between acute lymphocytic leukemia in infancy and subsequent osteosarcomas. Option B is incorrect because astrocytoma is the most common primary CNS malignancy of children. It has a slow, protracted course and presents with signs and symptoms of increased intracranial pressure, such as headaches, but there is no clear relationship between astrocytomas and osteosarcomas. And option C is incorrect because non-Hodgkin lymphoma is not associated with development of osteosarcoma. And option E is incorrect because also Wilms tumor, which is the most common renal tumor in children, has not been associated with the development of osteosarcomas.